Broadcasting from the beautiful state of Maine, welcome to another episode of the Learning from Leaders podcast, the show that focuses on identifying and developing the skills and behaviors that will inspire, empower, and compel others to follow your lead. Listen as Patrick's guests talk about the powerful leadership approaches they have identified and developed, which are vital for leading in today's challenging times. These are the same approaches that will positively impact you as a leader too. Learning from Leaders provides the right balance of leadership research with real-world scenarios, making it easy for you to rise above your best. All right, let's start the show.
Hi, everybody. I'm Patrick Veroneau. Thank you for joining me on another episode of Learning from Leaders. I spend a great deal of my time working with both teams and individuals in the healthcare field, and my guest today certainly provides a great deal of value, not only for the healthcare field, as that's her background, but I think overall in terms of there are pieces here that other professions, individuals will be able to benefit from as well. My guest is Dr. Lisa Rotenstein. She's the Assistant Medical Director, Population Health and Faculty Development and Wellbeing at Brigham and Women's Hospital. She has her undergraduate degree, her MBA from Harvard University, and her medical degree from Harvard Medical School. She's also a faculty member at Harvard Medical School. And our conversation today is going to focus on burnout and depression in the healthcare field and work that she's been involved in. Specifically, we're going to talk about a research paper that she co-authored with Dr. Constance Guille from Medical University of South Carolina. And although we're going to talk about burnout and its relation to depression in healthcare, I do believe this probably transcends into other professions and areas, the link between the two. And I think in the environment that we're in right now, where so many people are under so much pressure and stress, that this is a timely article that will provide hopefully some resources and some understanding on how you can address this if it's yourself or if you know somebody else that's going through this. So let's get into it. Dr. Rotenstein, I want to thank you again for taking the time to be on the podcast today, speaking specifically about a study that you had published recently in the Journal of General Internal Medicine. And the title of it was Substantial Overlap Between Factors Predicting Symptoms of Depression and Burnout Among Medical Interns. And although I'm sure it deals with medical interns, in the environment that we're in right now, I'm sure you would see this in many other places. And I was hoping you could talk about the study and really what prompted you to design this study in the first place.
Thank you so much for having me on the podcast. I have been studying burnout and depression for some time. I became interested in the topic actually from a business background, was in MBA training at the time coming from a medical background. In the medical world, I saw my colleagues, I saw trainees, I saw physicians struggling with burnout, with symptoms of depression. And at the same time, in my business training, was learning about how you affect the employee experience of care, how you tailor the workplace to their needs and their motivations. And it was a very different lens than we often apply in medicine. And so I have been studying this over time, including studies in JAMA, for example, showing wide variation in how burnout is defined, a study showing that more than a quarter of medical students have depressive symptoms. And this then led to the current study. And we were asking ourselves in this current study, how much of an overlap is there between burnout and depression? So classically, when we talk about these issues casually, we more often talk about depression having to do with personal factors and things going on in a person's personal life, as well as their innate skills. And we talk about burnout as having to do more with workplace factors. And yet it's not very clear from the literature that these are distinct entities. And we wanted to answer this question to understand how much overlap there could be both between the causes and the solutions. And so that's how we landed at the question. I'm happy to go into the results as well.
It was interesting because one of the pieces that I had read, just in terms of the definition of burnout, that there were over 142, I believe, different definitions for burnout.
That's exactly right. And so this was the 2018 JAMA study in which we looked across the literature. Our original question was, what is the prevalence of burnout among physicians? And we found that we actually could not answer that question because there was so much variation in how burnout was defined. And even among studies that use the mass-like burnout inventory, which is the most common instrument for measuring burnout, there were 47 distinct definitions of burnout. And so it's really hard to compare apples to apples. And similarly, it's hard to then do studies suggesting that you've had an impact or that one intervention that works in one place can work in another place because you just don't understand whether you're measuring the same thing. So that, I think, was a really key takeaway in terms of our limitations. The other important point is having to do with limitations in studying burnout is that we don't have the same limitations for studying depressive symptoms. There are standardized instruments for studying depressive symptoms, and these have been validated against clinical interviews, which are the gold standard for diagnosing depression. And so when you think about comparing these two concepts of depression and burnout, even though there might be similarities in terms of how you assess them, there are a lot of differences.
When you talk about the results from this study, what did you find?
So we found substantial overlap in the factors that predicted depressive symptoms and symptoms of burnout. We looked, as you said, among medical interns. And what was nice is that we were able to look at them over time. And then we were also able to ask them questions about personal factors. So, for example, a history of depression, their early family environment, their marital status, whether they had children. And then we also asked them about their workplace experience, including their overall workload satisfaction and their learning environment satisfaction. And we found a substantial overlap between the factors associated with depressive symptoms and the factors associated with two of the subscales of burnout, emotional exhaustion and depersonalization. And it told us, and these factors explained about a similar percentage of the variation in both depression and burnout symptoms. And it told us that really these concepts are probably not so different. And importantly, some of their contributors or their predictors are very similar. Now, what is the takeaway of that? It's actually, I think, a helpful takeaway. It's a helpful takeaway in that people looking to alter work environments to facilitate well-being don't have to think about the intervention so separately. So if you can improve the working environment, if the people who you're catering towards are trainees, if you improve the learning environment, that tells you that you can have an impact both on depressive symptoms and on burnout.
When you talk about the two different components, one is emotional exhaustion, which I think seems pretty straightforward. The other one, when you talk about depersonalization, what exactly does that mean?
So depersonalization has to do with the way you approach your work. And the particular subscale of burnout that we used has actually been created specifically for those people who work with other people. It's a scale called the human services subscale. But the way it applies to medicine and to many other jobs that have to do with service, it has to do with how you approach your work and how you feel about your work. Do you have cynicism when you think about the service that you provide or the population that you're interacting with? Have you removed yourself from that work emotionally? Do you have decreased empathy towards the people you work with and those you serve?
So it's almost a disengagement.
That's exactly right.
So when we think about this from a standpoint of, obviously, measuring depression seems to be much cleaner, right? The research is much more solid in terms of how you do that. From a standpoint of how we can address this, what are some of the things that you would recommend?
Yeah, and maybe I'll comment on the first point you made and then get to some of the solutions. I agree, based on what we know from the literature and on validation studies, that it is cleaner to measure depression or depressive symptoms. And yet that's not trivial in our society. So I think we should make that point up front. Unfortunately, in many arenas, there is still stigma. In medicine, there might be licensing ramifications. And so I think this is a point of ongoing discussion, even though we now know more about the overlap and we know that it is more accurate to measure depressive symptoms. I think the jury is still out on exactly what we should be measuring, just because it's much more than a data question. It's a question about how society reacts to the results.
Yeah.
In terms of how we address this, so I can speak about medicine, but I think that the implications really carry across to other fields as well. Something we have learned through studies in the medical field is that interventions that impact the workplace are much more likely to have an effect on symptoms of burnout than those that target the individual. And what I mean by that is when you think about individual-focused interventions, those might include meditation or resilience training. And when you think about interventions that affect the workplace, you might instead think about giving people their time back. So if people provided some kind of service, for example, teaching within medicine, giving them their time back for that and recognizing it, thinking about schedule modifications that might facilitate better work-life balance, easing people's interactions with electronic medical record, providing them extra support in the workplace. So for example, leveraging other members of the team to help provide care. We know that those types of interventions are more effective. And those are really what we should be targeting.
That is so interesting because, again, I have a lot of work that I do on the healthcare side, working more with nursing groups and smaller groups, but things that you talk about are relevant to what they do as well in terms of scheduling, a lack of resources that they might have, and how that plays into this level of burnout and anxiety that they experience.
And I think these are interventions that are not as simple and they're harder to enact, but they're incredibly important. The other piece of it is that there has been work showing that if you are going to introduce people to wellness curricula or to experiences that you think might decrease their stress or increase their resiliency, you should try to not make those use their outside time. So if you're going to provide yoga sessions, it might not be the best solution for those to be at 6 p.m. to be tacked on to the end of the workday. It really should be integrated in a way that further facilitates work-life balance.
Rather than throw one more thing on top of a day that's already completely crammed.
Yes, exactly.
I'm guessing with the current situation that we're in right now with this pandemic, this is somewhat timely for you in terms of this article or for those that are experiencing this, right?
Well, I think that the pandemic has brought up many additional issues and also highlighted issues that were present before but made us more aware of them. So I think there are big questions now around what does work-life balance mean in an era where many people are working from home? How do you define the boundaries there? We are much more reliant on technology at this point in time to help us get our work done. How do you achieve balance with technology when people are spending many hours a day on Zoom, for example? Some of the issues that I think have been highlighted, but that were certainly present before, are the differential impact or the differential prevalence of burnout among female physicians and minority physicians, and this applies across other fields as well. But we know from previous work that female physicians have higher rates of burnout than their male counterparts. We know from previous work that minority health profession students have a lower quality of life and a decreased sense of personal accomplishment. And so I think these are really important things to bear in mind, especially in light of the pandemic and a new way of working, to think about how do we ensure that the new workplace really caters to all people and helps all people thrive.
I will say from the work that I'm involved in, there certainly seems to be a much stronger drive right now for change.
I completely agree. And so I think the curiosity has to be on a few fronts. It has to be asking, not assuming that everybody's reality is the same as yours, and asking people what their realities are and trying to understand that. So many people at this point in time have newfound responsibilities, for example, of educating within the home. And how does that affect your workplace? How does that affect your interactions with your peers and then the boundaries you have on your time? Many people have newfound family responsibilities or newfound family stresses. So, having a curiosity to figure out what is going on within your workplace and then being creative about supporting that. And I think to your point, though, we have made strides over time in trying to find solutions to burnout, particularly in the medical world. But some of these we have to rethink. So, for example, we know that scribes can be used to help physicians with their documentation burden. Well, what does it mean to use scribes in an era of remote work? So we'll have to figure that out. We know that interventions that promote team-based care, so doctors working as part of close teams with nurses and social workers, can alleviate burnout and actually result in better patient care. But again, what does that mean when teams are remote and distributed? And then how do we remake systems to work effectively in this time of change?
You mentioned one thing around biases, and I would fully agree. There's such an important piece to understanding our unconscious biases in these situations, that we make judgments on people and situations and their experience without really understanding what it's like to be them and to have gone through these things. And from a leadership perspective, I see it certainly in healthcare. I see it in other industries that I work in, is that those, I think, that are in roles where people are reporting to them, if they don't truly take the time to appreciate all of the additional things that have gone on in people's lives because of this, they will miss an opportunity to engage people. It will increase this, I think, lack of trust within organizations and individuals, because people are dealing with a lot of different things right now. It's really grief that I think has been underappreciated.
And I think we're not done with the change is the key part of it. That change will continue to happen and the ways we work will continue to change over the next few months. And so gaining that trust through what you're saying, through asking people about what their realities are like, and through flexibility and through trying to find solutions for new work environments will be really key for helping people buy into the continued changes that will happen certainly over the next 6 months and probably over the next year or year and a half.
You wonder on some levels if some of the things that we've gone through, these to me almost seem like dress rehearsals for real change to happen. How do people deal with this?
Yeah, and they're real opportunities. I think we, at least in healthcare, have seen changes that would have otherwise taken 5 years, 10 years to happen otherwise, right? Telemedicine has really exploded and sprouted, and many of the hesitations we had about it, we just had to figure them out. And so it's a real time of opportunity. And the leaders that'll be really successful are those who adapt to the times in a way that is sustainable for the people they lead as well.
I would agree. So outside of healthcare, where I see it as well as remote work, people working virtually, where many organizations were very resistant to that of we can't do this. And that has been debunked, that myth that people can't work remotely. And I think it's going to be very difficult for people to try and put that genie back in the bottle.
Speaking of burnout in teams, though, how do you keep a pulse on your team in a remote working environment? And that pulse certainly has to do with getting things done, but also keeping up morale and understanding what people are worrying about and understanding how they are viewing the workplace. I think that is really the next frontier. There was a sense early on in this that we'll do this for a few months and we'll probably go back to the old way of working. And many of us realize that it probably won't be quite so simple. That'll really be the next frontier, is how do you recreate the great things about previous workplaces in a new way of working when all of us are remote.
I would agree with that. And that's something that I hear quite often, especially around this idea of culture. How do you maintain culture? And quite frankly, I will tell you that many organizations that I've experienced, I think they will be happy to see the culture that they had go away if it can, because it wasn't a healthy culture to begin with. So I do think there's an opportunity to rebuild here. But from a standpoint of behaviors, especially from what you're talking about, from interventions, I think it needs to be supported at the very top for this to take hold. And from a standpoint of individually, how do I inspire a team, empower a team, will require much more individual touch points with people.
And I'm curious, what have you heard about building and sustaining culture in this remote work environment?
I think everybody is trying to grapple with that. In my humble opinion, I think culture, for one, is about behaviors. It doesn't matter what you say your culture is, that it's how people behave will determine what that is. And from a leadership perspective, I know if I'm leading a group, it's going to require much more effort for me. I think shorter doses of having individual connections with people, contact on a more regular basis, and knowing my team that some people need more attention than others remotely. So it's interesting. We actually are just doing an assessment. It's a remote work assessment that allows individuals to basically answer questions on how they work remotely. A team from a distance, dealing with deadlines remotely, working under stress remotely, and what it allows individuals to look at is, what are my strengths if I've got to work virtually? And what are some of the challenges that I'm going to run into? And this can be shared as a team with a manager. And it allows people to, in this new environment, to say, how do we understand what our strengths and weaknesses are going to be here, and how can we play to those? And I think that's going to be really valuable.
And I think the challenge will be that managers will have to take the time to figure that out. And coming back to where we started with this depression, the overlap between burnout and depression in really large organizations. So for example, within training programs, it's often hard to get the pulse of such a large group of people. And so leaders will certainly have to find ways to do that effectively if people are going to recognize the changes they're making in the working environment and in the learning environment and keep workers healthy over the long haul indefinitely, but also the long haul of this pandemic, which I think, as we're seeing, continues to rear its head in different ways.
There's so much data out there, Lisa, in regards to belongingness. And really, we're pack animals, that we need connection. And I think those leaders that, again, maybe might not have understood this before, I think the distance creates more of a drive of people needing to feel connected. There's a sense of purpose to what I'm doing and to the organization that I'm with. And those that are able to identify this and navigate it will be the ones that will be successful in creating a different looking team.
I think you bring up a really interesting point. One of the things we know about medicine that is true in medicine and is true likely in other industries that both drives burnout and then contributes to disparities is a feeling of appreciation and access to networks of power. For example, we know that female physicians are promoted more slowly and less often than their male peers. We know that there are barriers to minority physicians gaining positions of leadership or positions associated with higher prestige or pay. And we knew in the previous way of working what some of the barriers were, even though we certainly have not surmounted them. But I do think this new way of working presents even more challenges to closing that gap. So how do you create the structures that allow you to really thoughtfully connect with a variety of members of your team and create connections that allow you to sponsor them and promote them in a way that is equitable? So there are perhaps opportunities there now that many of our interactions are over Zoom. Perhaps that is a more equitable platform, but I think there's a lot to think about there as well in terms of who is reaching out to who and what do some of those more informal connections look like in a time of remote work.
There are two behaviors that come to mind when I hear that, and it's work that we're involved in. Is one is around congruence, this alignment of what our values are and do we actually practice those? And the other is around clear expectations. And oftentimes what we've seen within organizations is that there is a disconnect between really understanding what is clearly expected, either to get to the next level, that they're not clearly defined. And if they are clearly defined, they're not held accountable. Those two things can be a real challenge within organizations.
They can. And I think, though, that there's also a piece of who gets opportunities and who learns about opportunities through what means. And I think that will be redefined in our time of remote working, potentially in good ways, but potentially also in unfortunate ways. And we all just have to really be thoughtful about that as another facet of this pandemic and how it affects the careers of a diverse workforce.
I would agree completely on that. And again, I go back, I just had this conversation earlier in the morning around organizational values. And oftentimes people, when they hear that, they roll their eyes thinking, the values. And why? It's because people don't feel as though they've had any sense of creation of those values. Is part of this process. If we really want to start getting back to, I think, real equity, or not start getting back to, but start having it, I think it's really time to pull out those values and really hold people, again, accountable to those. Here's what we say as an organization that we stand for. That's your compass. That's the organization's compass to be able to make decisions to say, is this behavior right now in line with what we state as our values?
And what actions do you have to take in a time of remote working to make sure that you ultimately act in congruence with your values? And maybe that takes a little bit more planning than it would have in a time of in-person work.
Yeah, totally. I think values are something that need to resurface as something that is real and not just something that was nice to put together on our website or in our employee handbook, but they mean something.
And I think there's a really great opportunity for that in the setting of the pandemic. When we have changed the ways we work, we have had to think long and hard about what we care about and the implications on our society. So it's a real opportunity to re-examine values for organizations, from healthcare to every organization imaginable, actually.
Yeah, without question. I do think that this is a period of time where people really have been pushed in ways that they said, something really needs to change here. Like, I'm not going to do this. The biggest concern that I would say is that you will have more people quit and stay than quit and leave their organizations if things don't change. Dr. Rotenstein, as we finish up here, based on your research and people listening to this that might be in the healthcare field and they're dealing with this, what would you recommend to them?
I think the biggest takeaway is to think about your work environment. There are undoubtedly many, many personal factors that play into both burnout and depressive symptoms. But we know that the work environment affects burnout, and we know that changes in the work environment can improve burnout. And the work environment has changed. And so to have a healthy workforce, we have to be willing to re-examine. We have to examine, what are people's new ways of working? What does the new workplace look like? And to make changes in a time of constant change, that's hard, but it's necessary, particularly at a time like this. I would also say that we know that the costs of burnout are real. In healthcare alone, we know that burnout is associated with worse patient outcomes, with decreased quality of care, with increased turnover of employees. This is an issue with real economic and health consequences, and it's one to take extremely seriously.
Such an important point to leave on, that there are so many different levels of implication here that I think are important to look at, whether it's the financial health of the hospital, the patient's health. There's impacts all along the way here. I appreciate you taking the time again to speak to the research that you have done. And I think it's so important for us to really understand, how do we address this? So thank you for that.
Thank you so much for taking the time, and would be happy to talk to anybody listening about these issues. The best way would be by email, my first name.last name@gmail.com.
And I will have that in the show notes as well. So again, I thank you for your time. Good luck with all that you're doing right now. Thank you for putting this together to be able to help those that need this.
Of course.
Thank you.
Thanks so much for listening to this episode of the Learning from Leaders podcast. If you've enjoyed the show, please feel free to rate, review, and subscribe on your preferred podcast listening platform. We really appreciate that effort. Until next time, keep rising above your best as a leader.